Welcome to What the Freud. I'm your host, Gypsy Roach. There's a line in Captain America Civil War where Spider-Man says, when you can do the things that I can, but you don't, and then the bad things happen, they happen because of you. I'm going to let you keep guessing as to how this ties in, but trust me, by the end, you'll get it. Now, let's talk about some medical breakthroughs that almost didn't make it. Not because they didn't work, but because somebody resisted change. While we celebrate the ones that made it through, don't forget that every delay in innovation has a cost. And that cost, it's measured in lives. Anesthesia. Introduced in 1846, anesthesia could have revolutionized surgery overnight. But surgeons weren't in a hurry. Why rush when you can keep patients fully awake and screaming during procedures, right? It wasn't until Queen Victoria used chloroform in 1853 that anesthesia started to gain some traction. But even then, it took decades for it to become standard practice. In the years between 1846 and the late 1800s, approximately 1.2 million surgeries took place in the U.S. alone. Just imagine how many of those patients could have been spared excruciating pain if doctors weren't so resistant to change. Pain was considered a necessary evil of surgery, and we can only wonder how many lives would have been improved sooner if the medical community hadn't dragged its feet. I mean, I wouldn't have been signed up for surgery without, anesthesia. Next up is Pap Smears, introduced by Dr. George Papanicolaou in the 1920s. The Pap smear has saved countless lives by detecting cervical cancer early. But back then, the medical community wasn't exactly excited about it. I mean, why detect cancer early when you can just wait until it's too late? The idea of regularly screening women for cervical cancer was met with skepticism. Many doctors didn't believe it was necessary, and the idea of adding this routine test to women's healthcare seemed like a lot of unnecessary effort. They'd rather deal with the cancer when it showed up. Despite resistance, Dr. Papanicolaou's relentless research and the eventual irrefutable data proved that Pap smears saved lives. But it wasn't until the 1950s, 30 years later, that Pap smears became a routine part of women's healthcare. During the decades in between, how many women would have benefited? Countless. Today, cervical cancer rates have dropped by more than 70% because Pap smears are routine, proving that early detection isn't just a nice idea, it's a lifesaver. Penicillin. Discovered by Alexander Fleming in 1928, penicillin is the first antibiotic and a literal lifesaver for bacterial infections. So naturally, it should have been an instant hit, right? Wrong. The miracle mold almost went nowhere. Doctors and scientists were hesitant to jump on the penicillin bandwagon because producing it was difficult. Plus, some experts doubted it would be useful for widespread medical treatments, and the pharmaceutical industry wasn't exactly thrilled about figuring out how to mass produce it. It wasn't until World War II when the need for antibiotics became critical and that penicillin's mass production took off. Researchers figured out how to grow it in large quantities, and suddenly penicillin was being used to save countless soldiers and later millions of civilians. Timing is everything, it seemed. Had it been widely available from 1928, the lives saved could have been staggering. Instead, the world waited almost 15 or 20 years for what was right in front of them. CPR, or cardiopulmonary resuscitation, is one of the most basic and life-saving procedures for people in cardiac arrest. You'd think the medical world would have jumped on it the second it was developed in 1960, but no. Why save someone's life when you can just stand there and wait? Many doctors were skeptical that CPR could actually bring someone back from the brink of death, and some were concerned that the chest compressions might do more harm than good, while others just didn't believe that it was, something that was worth trying unless the patient was already in the hospital. As training programs and demonstrations showed that CPR worked, especially outside of hospitals, its adoption grew. Once the American Heart Association got involved and launched massive public education campaigns, CPR became a life-saving technique that everyone could learn, not just doctors. Thank goodness. Today, it's common knowledge, but it almost didn't make the cut. The time lost, who knows how many lives could have been saved if it had been rolled out sooner. Handwashing and antiseptics. Handwashing is the simplest and most effective way to prevent the spread of infections. But when Ines Semmelweis proposed it in 1840 after finding that handwashing reduced maternal deaths in childbirth, the medical community not only scoffed, they had him committed to an asylum. What What was he thinking, wasting his time saving women? Joseph Lister introduced the use of antiseptics in the 1860s to prevent infections during surgery, but the idea that surgeons should sterilize their tools and wash their hands? Yeah, right. Despite the fact they often served as coroner and surgeon, going directly from handling the dead to performing surgery on the living, doctors were downright offended by the suggestion that they could be killing patients with their dirty hands. Washing hands was considered beneath the dignity of a professional physician. And after all, if you couldn't see the germs, were they even real? That was just preposterous. They knew perfectly well the problem had to be something more reasonable, like miasma, bad air, or an imbalance of bodily humors. You know, those different colored bodily fluids connected to celestial bodies, seasons, body parts, and stages of life. It's complicated, I know, but it came from the ancient Greeks, and they really knew their science. Despite evidence cleanliness helped patients, physicians clung to the old, tried and not quite true methods of the past until Louis Pasteur made them believe in germs. By the 1870s, 30 years later, hand washing was a thing. Those good doctors always looking out for patients by not rushing into things, right? I mean, spending a few minutes on hand washing was downright inefficient. Think of how many more patients they served by skipping that step. So back to that Spider-Man quote, when you can do the things that I can, but you don't, and then the bad things happen, they happen because of you. The medical community could have saved lives earlier, easier, and often with less pain, but they chose to delay making the necessary changes. Ego, profit, and just plain stubbornness cost lives, and the breakthroughs we know about are just the tip of the iceberg. How many other life-saving innovations were buried while protecting profit, ego, and tradition instead of patients? I tell you, for a profession known to loathe being questioned, they have a serious history of questionable priorities and choices. Be skeptical and be safe. Check out the playlist here and the video there. Don't forget to subscribe. Thanks for watching.